Hi everyone! Thank you all for being here today. My name is Jenny and I am a second-year medical student. This summer, I had the incredible privilege of completing a global health rotation in the Philippines. I'm sorry I couldn't be with you in person today, but I couldn't pass on the opportunity to express my deepest gratitude to you all. Some of you may be wondering what kind of impact your generosity has. For me, that impact began long before I even set foot in the Philippines. Global health has always been deeply personal to me. My mom grew up in Nanjing, China at the tail end of the polio epidemic. Although the oral vaccine was growing in availability, the heat of summer and a lack of refrigeration made it impossible for her to get vaccinated. Before the age of 3, my mom contracted polio. Throughout the years, her medical journey has inspired my commitment to helping people access life-changing medical care, no matter where they are born or how they grow up. So when it came time to decide where to attend medical school, I knew I needed to be somewhere that valued global health as much as I did. So in many ways, you and the Havey Institute are the reason I am at Northwestern today. You are also the reason why I was able to go to the Philippines, a country rich in culture, history, and hospitality. On my trip, I split my time between the bustling capital city of Manila and the remote island of Tingloy, a rural community of less than 20,000 people. In Manila, I rotated through different hospitals and clinics. At some, the air was hot and heavy. The ground was lined with patients waiting weeks to be seen. The staff was confined by limited resources. At others, we were greeted by gusts of air conditioning, concierge services, empty waiting rooms, and private suites. I imagined what it might feel like to be a patient in these vastly different hospitals. When I arrived at the island of Tingloy, I joined a team that provided vaccinations to indigenous children. We traveled across the island in the heat of summer, carrying a small cooler of vials. As we administered the oral polio vaccines, I thought back to my own mom, who was never able to be vaccinated. This experience was more than just a rotation. It was a chance to care for people who, in many ways, reminded me of my own family. Global health is deeply personal. It's about helping families like mine and like yours, no matter where they are born or how they grow up. It's about learning from each other's experiences, sharing stories, and working together to build stronger, healthier communities. And for me, it's about building on these experiences to be a more informed and empathetic physician. So from the bottom of my heart, thank you, thank you, thank you for investing in this program, in students like me, and in the health of our global community.